name's Jamaico, and I consent to this video.
Okay, I'm doing the 360 scan. Okay. Okay. Hi, my name is Michaela. I'm a registered nurse and I'll be doing your assessment today. Could you tell me your full name?
Jamaico,
Okay. And your last name?
Bangan,
And when's your date of birth?
June 4th, 1996.
Okay. And any allergies?
No.
No? Okay. So I'm just going to check that you have your ID band on. Okay. And I see there's no allergy bracelet, which is perfect. So what brings you in today?
I'm just feeling cough whenever. No, I'm feeling cough, and it comes with pain when I cough harder,
Okay.
but no mucus.
Okay. Do you have a health history? Any diagnoses? Nothing? Okay. All right. Well, I'm going to be doing a physical exam and a little interview. So we can go ahead and start that if you're comfortable with it.
Yeah.
Okay. So when did this cough start?
Started a week ago.
Okay.
Yeah.
And what does it feel like?
It just feels tight when I cough, so I force it out, and then I feel pain on my chest.
Okay. And where is the pain?
Just below my chest down here.
Okay. And so when you cough, the pain comes, does it go away right away or does it?
Yeah, when I stop coughing.
Okay. And what does that pain feel like?
It's like more like stabbing.
Mm-hmm.
Yeah. Stabbing type of pain.
And does it radiate anywhere?
No.
Okay. So it just stays right there. Okay. And on a scale of 1 to 10, how bad is it?
It's like 3.
Okay. Mm-hmm. Okay. So at this point, I would take a set of vitals. So his blood pressure is 120/80. His pulse is 70. Temperature is 36.6. And his oxygen saturation is 98%. His respiratory rate is 16 and easy. And subjectively, he doesn't appear to be in any respiratory distress, and no extreme pain at all at this point. Okay, so if you're all right with it, I would like to start with my physical exam, examine your chest and your lungs. Okay?
Good.
Okay. So I'm going to start by visually inspecting the chest. So I'm just looking for any pockets in the skin where air could be trapped under the skin. I'm looking for the symmetry of breathing, the chest expansion. And everything appears to be in the right order. Yeah, so I'm going to do the same thing with the back. And I'm observing, expanding, contracting. Okay, so now I'm going to palpate. Is it okay if I palpate your chest?
Yeah.
Okay, so I'm just feeling for any of those trapped air pockets. Okay, and again for the back. Okay, and I'll just get you to turn around. Okay, and I'm just gonna put my hands on the chest wall, and could you take in a nice deep breath and out? Okay, so I can feel with my hands that the chest is expanding bilaterally, like one side's not going up before the other, it's very even. Okay. So now I'm going to have a listen. So I'm going to be listening in between the intercostal spaces And I'm listening for any crackles or wheezing. Yeah, so I'll go ahead and do that. So every time I touch you with the stethoscope, I just want you to take in a nice, slow, deep breath. Very good. So I didn't hear any adventitious sounds. Everything sounds clear. So I'm going to do it again, listening to the back. Okay. So when I listen to the back, I'm making sure to avoid the scapula, and I'm listening on the lateral sides for those lower lobes. Everything sounds good. There are breathing sounds in all of the lung fields. Okay. So now we're gonna move on to the cardiac assessment. So do you have any chest pain, tightness?
Yeah, just when I cough it out.
Mm-hmm.
That's when I feel it on my chest area, like this side.
And on a scale of 1 to 10, you said it was
3.
3, right? Okay. And it doesn't radiate anywhere.
No.
Okay. All right. And the pain only comes when you cough, correct?
Yeah.
Okay. So I'm going to do the cardiac physical assessment now. So I'll start by observing the chest again. So I'm looking for any pulsations under the skin, observing the jugular vein. Nothing's distended. I don't see any cardiac pulses that are able to be visualized. So now I will palpate for the cardiac pulses. Is it okay if I go ahead? Okay. So I'm going to start by finding the second intercostal space on the right side of the sternum. And I'm just feeling for pulsations. So now I'm going to move to the left side of the sternum, second intercostal space. And third intercostal space on the left, fourth intercostal space, fifth intercostal space. And now I'm going to move to the mid-clavicular line in the fifth intercostal space. And here I should be able to feel the ventricle pulsations. Okay, very good. So now I'm going to listen over those same points. So that's the second intercostal space, third, fourth, fifth, and the mid-clavicular line, fifth intercostal space. Okay, and I'm able to hear S1, S2. The lub dub, and the dub is louder, which is a normal finding. So now I'm going to assess the peripheral pulses. So first thing is feeling the limbs, making sure they're warm, the color's good. So I'll go ahead and do that if that's okay. So both arms are the same temperature. I can check the capillary refill. Very good. And on this one, good. Now I'll check the radial pulse. And on this side, brachial pulse. And on this side. So all the pulses are even bilaterally. His arms are perfused well. Both limbs are warm. So now I'll observe the feet, legs, and I'm checking for edema as well. The legs are a very good color, so I'll just touch them if that's okay. And so they're both warm. I'll feel for the dorsalis pedis pulse. Okay, and then the tibial. Okay, and both are even. The legs are warm. Everything looks good. Okay, and that concludes my cardiac and respiratory assessment. Thank you.
Thank you.